Great. Thank you very much, Heather, Dale, and Jessica. That was very informative, and we really appreciate your presentation. We've had a number of questions come in while you were speaking, so at this time, I'd like to go through some of these. We know we won't be able to answer all of them. For all of our participants, please know that we will gather up questions and group them to create a Q&A that will be distributed with the archived webinar after this presentation. So let's start with the first one, and we'll let the presenters determine who best to answer this. The first question is, how do you inform families about the data assessment process and the tools that you're using without marginalizing them or presenting information at too high a level for parents to understand?
This is Dale, and so I think probably all of us have a couple points to add to this question, if we understand it correctly. But as I mentioned, certainly we're not sharing all of these different graphs and numbers and tables that we've shown you here. These are examples of the different the levels of information that we use here to discuss data, to use data to really inform practice, and the necessity is there to have data at all these different levels so that we can really address the complex issues of planning and programming for young children. The reports for parents are they're vetted, they're read by parents, they go through the policy council, they are very much inclusive of information that parents have asked for and want to have. And the process of using portfolio information, for instance, and involving parents in that process gives them an opportunity to also share information that isn't necessarily assessment reports. So those assessment reports are shared in teacher, family, individual meetings twice a year. This other information is shared more frequently with families on an ongoing basis, and so Heather and Jessica will expand upon that.
This is Heather. I also just wanted to follow up on what Dale said, and as Jessica mentioned earlier, no data about a child is ever just given to a parent. It's always done as part of our partnership with them and as a way to inform the conversation between the parent and the provider or the teacher or the family support advocate. The other thing I wanted to mention is we talk about school readiness, and we talk about that for our children, but we are also always thinking about school readiness in the context of the family, and that family and those parents being school ready. We know that they will receive a lot of information and reports on their children in their child's future years in school, and we want them in a setting where they have a partnership with us to really learn how to look at that data about their children, what type of questions to ask about that, what they should know about their child, and how to advocate for strategies that will support their child's growth. So we really see that sharing of data as a learning opportunity for parents so that they will also be school ready and ready to support their child's education for the long term.
Great, thank you. Kind of along the same lines, how do you handle situations where perhaps the parents and the educators don't necessarily agree on the assessment data that's been collected, or they see the child from different viewpoints?
So this is Jessica, and we have run into this a couple times. We have a couple different strategies. So sometimes we have parents do assessments with us, so they'll complete the assessment and we will complete the assessment, and then we'll have a conference where we kind of talk through each part of the assessment to kind of see where any differences are. And we recently had a family that we were worried about some areas of development, and the parents didn't seem to be as worried. And so the teacher completed one of the assessments, and then the parent completed one, and they just talked through each area of the assessment, and kind of the conversation did come to the fact where the parents' concerns did show. In addition, we also have parents be part of those assessment processes, so whether they're being a play partner or they're helping us with that assessment, that way they can kind of, you know, see what we're seeing in those ways.
Okay, thank you for that. Shifting gears just a little bit, could you define for us what a master teacher is? And secondly, could you share the qualifications that are required in your programs? For example, are the teachers certified, or do they have a CDA? Exactly what their training level is.
Sure. This is Jessica again. Master teachers are coaches, mentors, classroom support for the classroom teachers. Our master teachers have advanced degrees in early education and additional years of experience working in early education, and their job's really to work alongside classroom teachers and provide support on a daily basis. They spend most of their time in the classroom. We have 3 master teachers, and each master teacher has 4 classrooms, and they're in charge of helping those teachers in those 4 classrooms. Our classroom teachers have lead teachers are bachelor degree teachers. We have assistant teachers that have associate's degrees, and then we have aides that have at minimum a CDA.
Okay. And how do you provide professional development for teachers throughout the year so that they are current in the assessment tools that you're using and in their methods for working with families?
Professional development is a huge piece of learning about assessments and being able to share data effectively and partner with parents when sharing data. So we really make sure that we're very intentional with our professional development with our teaching staff. We are very lucky, and we meet weekly to have reflective discussions with different focuses throughout the month. We also have time set aside throughout the year, so 10 to 12 days throughout the year where we are meeting and doing training, looking at assessments, keeping teachers up to date on what the information is. And then also we make sure that all of the data that we see in our monthly meetings is shared with classroom teachers so that they have time to look at it and ask questions about it and kind of make their own decisions or assumptions based on that data, so they can kind of understand where things come from, and if we're change our focus, if our class score is low in one area and we're going to look at feedback loops, the teachers will understand where that came from because they also get to see all of that data.
I see. And so do you have any specific recommendations for the types of professional development or in-service topics that our participants should look for when training their own teachers?
We try to use reflective practice in all of our programs, so making sure that we're really looking at what we're doing in our classroom, the practice of working with our parents and families, and then taking the time to sit and talk as a group about how that's working. I don't have any specific.
We also, that is one of the benefits of our research program partnership. In the past, our research partners, so Dale Walker or Jane Atwater or others, have come and talked about the assessments, talked about the results, and then Jessica and the master teachers as a follow-up to that have had reflective discussion groups about that, so teachers could really go through the same process of asking questions about the data, determining what it means, how it might inform their practice, how it might inform us as a program. So we've also had those opportunities for the evaluators to come and provide that professional development for our staff.
Thank you. Can you talk a little bit about the role of your teachers in identifying any possible delays or disabilities or anything along those lines? How is that handled when teachers identify those potential situations?
We really take a team approach when working to identify any concerns or special needs of children in our classrooms. So classroom teachers, like I shared earlier, they are collecting multiple different assessments and screenings on children, but also we have our disabilities coordinator and our family support staff, and we'll come together if we have a concern about a child and discuss as a team if we feel that we need to make a referral. But it is not something that we had ever put on one teacher specifically, but something that we'd work together to decide and make that decision to support the family.
So are you also collecting child health data in your records?
Yes.
And can you share a little bit about the types of topics and information that you would collect or keep in those records?
Around child health data?
Correct.
So we keep track of the child's schedule of well baby, well child visits, their immunizations, any concerns or ongoing health issues that they might have, any health plans or specific needs that the child has been identified by the doctor so that we can work with the parents and support that. We have, over the years, developed a very strong relationship with our local provider of infant toddler services, and they are also present on site in our classrooms and helps facilitate that referral process that Jessica has spoken about. And we have that partnership helps us share that information about assessments, about screenings, about health, and then even past the referral point to continue to work together to really develop strategies that support that child.
It sounds like a very comprehensive process that you've developed and that you've put forward for families, and it's very supportive. Just want to shift gears a little bit to a couple of the questions that we received around planning time for teachers. How do you structure the time that teachers have to prepare for the assessments, to actually implement the assessments, and then to lastly prepare for the meetings that they'll have with families?
This is an ongoing work between master teachers and teachers, making sure that teachers have sufficient time to get work done. Lots of times teachers are working in classrooms during nap time, so they each have a little desk area and a computer that when children are sleeping, they can be working on portfolios and creating documentation. We have assessment due date chart that we use to kind of track when assessments are coming up, and master teachers will work with classroom teachers to make sure that if they need some extra time for the master teacher to step in to help the classroom teacher get the assessment completed. But it is just really a balance between the teacher and the master teacher and making sure that they're communicating with each other to make sure that all of those things are done. We also try to make sure that teachers are aware of things that are coming up so that they know that there's going to be a parent-teacher conference, and they're preparing throughout the whole year for that conference with documentation, so it's not one big, preparation right before the conference.
Do you also provide the parents with some kind of a calendar or some kind of a system where they know exactly what points in the year that they should anticipate a parent conference?
Yes, we share that information on a full year parent calendar for parents to let them know when those things will be happening.
Fantastic. So this is a question that's a pretty large question, and it's come up a couple of times today, but it has to do with the definition of school readiness. How does your organization define school readiness? What's important to your teachers around school readiness, and how do you communicate those important factors to families?
This is Heather. That is a large question, and people define school readiness in a lot of different ways. As I mentioned, we tend to think more broadly about the school readiness of the family. So around the child being a developmentally appropriate place when they enter kindergarten, and being able to sustain that learning through the coming years, and also for parents to be prepared to support their children as they go throughout their school careers. We've identified school readiness goals across all developmental domains, and so the assessments that we use really help us track children's progress. We provide a lot of education to parents about a child's anticipated growth in those areas, strategies and ways they can support that ongoing growth in the home and outside of the school setting. One thing we haven't mentioned yet about our Educare model is that we are co-located in our Educare school with, between Project Eagle's infant, toddler, and preschool teachers, as well as preschool teachers and special education teachers from our local school district. So our children and teachers are blended in those classrooms. We're sharing a lot of professional development. We do a lot of planning together. And so we have a nice continuum in place to support children from the time they enter Educare, which might be as early as 6 weeks, to the time that they transition to kindergarten. We work a lot with parents on what those periods of transition will look like, what they can expect, how they can support their children, how they can advocate for their children. And so that's not a simple definition of school readiness, but it's really assuring that that child and that family will continue to experience success at the point when the child enters kindergarten, but also down the road in their school career for the coming years.
Right. I think that piece that you talk about with involving the families and making sure that the families are school ready is really an important part of what you're doing. Can you share with us how you handle situations where perhaps the visit is scheduled with the family and the family continually backs out, they don't show up for those meetings? What do you do in order to ensure that that information gets into the hands of the parents?
So we try to really work with families and meet them where they're at. And so while it is usually optimal if it's a home visit, if a family prefers to meet in the center, then we will, adjust and do that. But we try to be as flexible as possible in order to really make the visit happen. Like I said before, we do have scheduled days and scheduled times, but our family support staff works with families depending on their work and school situations to reschedule. We work together as a team to make sure that classroom teachers can be relieved from their duties so they can go and participate in the home visit if it is on a day that it is not scheduled. And oftentimes, if families need to just have the meeting here, we see that it's better to have a meeting than to not have a meeting. So if it needs to be here on site, then we will make that accommodation. But we really try to individualize for each family, for their situation, and work together as a team to kind of see how we can best meet their needs.
Do you ever, oh, I'm sorry, go ahead.
I was just going to share an example of something that happened this past spring. I think families come to really appreciate that time for parent-teacher conferences and the visits we do in the home. This past spring, one of our staff went out to a parent's home, and dad was available for the conference, but mom had to work, and she had actually prepared and left a video of what she wanted to share with the teacher and the family support staff person. And so that could be part of the conference, and so she could be part of it that way. So I think we set that expectation early on that that's part of their experience at Educare of Kansas City, and parents really buy into that.
Do you ever find that families are reluctant to allow the educators into their homes because perhaps they might feel like the teacher is there to collect information on the family, or any barriers of that nature that you could share with us, or give us examples of how you've overcome those situations?
We're all looking at each other because we don't really experience that as a barrier. I think because we do work to establish that partnership from the first moment of interaction with the parent. They're very excited for us to come out and meet with them, to have the opportunity to learn from them about their child. We consider them to be the expert on their child, and so that just gives us another opportunity to grow that partnership. We try to be flexible, as Jessica mentioned, and work around work schedules and whatever the family situation might be. So in that way, we eliminate some of those common barriers to doing those types of visits.
That's good. I'm sure that makes the families feel a whole lot more comfortable with the entire process. Could you talk to us about the types of observation forms or processes you use for watching how the parent interacts with the child? Do you have anything like that in place?
We have, this is Dale, in different projects that we have partnered on, we do have then civic interest on with if it's a project working on parent-child engagement per se, then we would be collecting data like that. In this partnership right now, for looking at this Educare program partnership with parents and sharing data, the emphasis in sharing, so we use the information, for instance, we use some examples about language development, and sharing information about ways that parents might engage more often or include strategies that we've worked through the research here and capitalizing on research nationwide about strategies to enhance that communication interaction. So that information will be shared with parents. And so for this particular project then, there are ways that parents can kind of evaluate their use of it and talk with the classroom teacher. And so that's actually going to be one of our projects this coming fall. Kind of stemming from some of the information we all shared as a group about language development over time and early literacy development and some of the needs in that area, we decided to partner some more on sharing this intervention work, and it will be done in classrooms and in homes. And so that's one example. There are many other examples of other topic areas that we would do something like that with.
Right, thank you. We recognize that folks are very busy, and if it's necessary for you to leave the webinar, please note that there is a survey we'd like you to participate in, and the link is in the chat box. If you would just take a couple of minutes to do that, that would be fantastic. We're going to continue with some more questions before we wrap up our time together, but I just wanted to make sure you were aware of that opportunity to provide feedback. Heather and Dale and Jessica, we've had some folks ask about the population that is served through your program. Could you give us a better idea of maybe the race and ethnicity of the children that you are primarily serving? And then secondly, could you describe the programs? Are these Head Start programs or non-Head Start programs? Are they community-based and so on? Maybe give us a demographic of where these programs are located.
This is Heather. So at Educare of Kansas City, we are several programs blended together. So children who are enrolled in Educare might be early Head Start children. Some of them are Head Start children, and some of them are served through local school district programs, either for special education or for at-risk preschool populations. So there's a blend of children here at Educare of Kansas City. In general, so Kansas City, Kansas is an urban community of the greater Kansas City metropolitan area. All children served by Educare of Kansas City live in Wyandotte County or Kansas City, Kansas. They initially qualify for the program based on income qualifications, so a household income at or below the federal poverty guidelines. The population that we serve is very diverse. We serve any given year, approximately 50 to 60% of the children we serve in our classrooms come from a home where Spanish is the primary language. We serve a handful of other languages and refugee populations on site in our classrooms. You want to add anything? So that gives you kind of an idea of the demographic that we are working with. We prioritize for enrollment in the classrooms parents that are working or going to school. So our parents are very busy, and that requires us to be thoughtful about the way we schedule and set visits and conferences with them.
So when you say that you're serving a variety of populations with a large difference in language needs, how are you meeting those language needs? What are you doing when you've got a family that is a non-English speaking family, for example? How do you get that information into their hands so that they can understand it?
For our families that speak Spanish, all of our family support staff that we have on site are bilingual. Bilingualism, English-Spanish, is a preferred qualification for all of our teachers. It's a challenge, as I know it is in many communities, but we attempt to hire teachers who have that background. All materials that we provide to parents are in both English and Spanish. For families that speak other languages besides English and Spanish, we are very creative with our strategies, but we also work with local interpretation services when we need to have conferences or meetings with parents.
Great,
and the assessments are administered, for the assessments that are administered by the evaluation team, those are all administered in either Spanish or English, and again, when needed, we have to use other sources for interpretation. So.
I see. Let's talk for just a moment about how teachers use the data that's collected. Can you tell us what their planning processes are? What do they do after they've now assessed children, they've collected the data, they've met with families? What comes next for those teachers and the children in that process?
So as discussed in the presentation, teachers will take all of that information and use it during the team planning process. So we use a reflective curriculum and high scope curriculum, and teachers will use those curriculums as guides along with the data and plan activities for the classrooms. All of our lesson plans are individualized, so each classroom activity focuses on specific areas where all of the children in the classroom need development in, and so teachers will just individualize for the classroom that they have and use that data to help inform that process.
So if you had a program that had fewer resources available to them, would it be possible for you to prioritize the parts of your program that you feel are the most impactful to families and provide, I guess, the most bang for the buck? How could you boil that down into something that folks can walk away and say, I can really do this with my program, even on a limited budget?
You know, I think the key there is that relationship between the teacher, the classroom teacher, and the parent, and that partnership, and the value that that teacher places on the parent's observation and information about the child. So I think Jessica did a nice example of talking about many different types of data, so formal evaluations, but also that documentation of what's happening in the classroom, that information from the parents about what's happening in the home. And so that conversation, the ongoing conversation between parents and teachers, is a component that I think can exist in any program, regardless of their structure or what resources they have available. I think we're fortunate to have the type of professional development schedule that Jessica mentioned, but I think any time that programs can carve out for reflective practice, for discussion, for planning between teachers, will be helpful and beneficial.
Great.
And related to research, partnerships, capitalizing on opportunities, local higher education facilities typically will have some opportunity to partner with practitioners, with researchers or others who are at that agency who can do evaluations as well. And so that can be a really mutually beneficial partnership too. So, you know, taking some initiative or, you know, being pretty creative about establishing those partnerships is also another way to build some of the evaluation and the research components in.
Great. Those are some fantastic ideas. One last thing, as you think about your presentation today, is there anything, any topic that you'd like to expand on as we wrap up now? Any last thoughts?
Any from you?
No, it's been very engaging, and I really appreciate it. I know the participants appreciate the time you've taken with us here today. I'm going to turn it over to my colleague, Claire Irwin, now at this point. But on behalf of REL Southwest, thank you very much, presenters. Claire?
Thank you, Janice. And again, I just want to thank our presenters, Heather, Dale, and Jessica. I think you did a wonderful job clearly describing your program and the processes that you use. And I think what intrigued us most when we first reached out to you was that you're really engaging in this process with families, and it's hard to do. And the processes that you're using within your program, I think, are applicable across age groups and across different program types. And you've done a nice job of presenting that today. So thank you very much. Thank you also to our production team. They've done a fabulous job keeping everything in line and keeping us moving, and also to my co-moderator, Janice, for doing such a great job with that question and answer session. It was quite a few questions that came through from our attendees, so we also need to thank you for engaging and for staying with us today and for joining. So before we break, I just want to thank everyone again and just remind everyone that we are very interested in your feedback on today's presentation. We are being now sent to the link automatically. If for some reason your pop-up blocker keeps you from getting to that survey link, there have been links posted in the chat box, as well as there is a link under the closing and evaluation box that you see. There's a blue, it says please complete the survey, the stakeholder feedback survey, and you can click on that. It should take you to the webinar, to the survey link. So thanks again, and your feedback will help us plan future events like this one. And I hope everyone has a wonderful rest of their day. Thank you.